Promethazine. Promethazine, also known as Phenergan. Okay, Phenergan is also a phenothiazide. Much like Compazine, the action is to suppress the CTZ. Which is the chemoreceptor target zone in the medulla that controls vomiting or induces vomiting, tells the stomach to reject the contents based on blood chemistry or medication. Syrup of ipecac would stimulate the CTZ. Okay, so this has also antihistemic qualities or effects. Okay, so it is also going to have those same qualities or effects as similar to Compazine. It's going to have the sedatory effects or the sedation effects, as well as the antiemetic effects. So our indications with Phenergan are nausea, vomiting, these are generally the only things we're going to give for is something that's causing nausea or vomiting or inducing nausea or vomiting or a condition of nausea and vomiting. We're going to give 12.5 to 25 milligrams, which I will say that I have given as low as 6.25 milligrams. It depends on the physician. So let's change that. (6.25 to 25 milligrams), and that's given IV, IM, PO. Okay. So one of the complications with Phenergan and why it's not very favorable pre-hospital use is that giving too much of it to control the effect can give a slurred speech. It can give confusion, drowsiness, sedation, the extrapyramidal symptoms. In essence, it can mimic a stroke. Okay, in some cases, I used to use this at an ambulance service in eastern Kansas. We would give it to control the nausea and the vomiting, and they would hold the patient for another 4 hours until it wore off enough to get rid of these adverse effects so they could rule out stroke. I think they were a little overbearing with that, but you know, they've got to cover their butts too. So anyway, back to our adverse effects. Drowsy. Oh, hold on. Contraindications first, right? I don't know where I'm getting ahead of myself, but contraindications is allergy to the med. Allergy. So our adverse effects again, drowsiness, dizzy, dry mouth, sedation, extrapyramidal effects. or symptoms, whatever you want to call it. You know what I'm talking about. Tremulousness, the twitchiness, the whatever you want to call it. Again, this one is the same. Use caution with CNS depressants. Also, if this gets outside of the vein, if you have a bad IV or infiltration or whatever, this can cause local tissue injury and necrosis. It's not used in the pre-hospital setting near as much as it used to be, but the ER does use it, but they do use it in very low doses. That's where the 625 comes from, 6.25 milligrams. So know that it is still used, but it's not a common sight, especially in the pre-hospital setting.